Our next speaker today is Melanie Pitrolo from the U.S. Forest Service Southern Research Station. Melanie is a native North Carolinian who gets to live and work in her beautiful hometown of Asheville, North Carolina. She holds a BS degree in Environmental Science and Engineering from UNC Chapel Hill and an MS degree in Environmental Engineering from Georgia Tech. Her professional specialties include working with national forests to manage the potential public health smoke impacts from prescribed fires, as well as assessing the effects of industrial air pollution on national forests, especially from acidic deposition and regional haze. So welcome, Melanie. We're glad to have you with us today. And one moment, everyone, as we trade out slideshows.
All right. Well, thank you so much for inviting me to speak with you all today about wildland fire and smoke, particularly in the middle of a public health crisis. I'm going to talk a little bit about what the U.S. Forest Service is doing and has done in the southern region during this the last 6 to 8 months, and some tools that I think that you might be interested in to help you assess the impact that your fire may have on your local communities, while also being mindful of the potential for impacts to the COVID-sensitive populations. So I wanted to spend just a couple of minutes talking about why smoke from wildland fire is such a public health concern. There is an old adage that says, where there is smoke, there is fire, but the converse is also true. Where there is fire, there is smoke. So in a perfect world with complete and perfect combustion, only 2 things would be emitted from fire, from burning, leaves, brush, etc. And those would be carbon dioxide, CO2, and water vapor, or H2O. However, we don't live in a perfect world. We live in reality, and in reality, there is not complete combustion, and thus we get a lot of other things that are emitted from our fires. Now, the most important from a firefighter perspective, the most important pollutant would be carbon monoxide. That you all know is a very dangerous component when you're on top or near the fire. However, carbon monoxide dissipates rapidly as you get further away from the fire. And therefore, from a public health standpoint, the other pollutants that are listed there are of most concern. I would say that particulate matter, I wouldn't just say it, I can verify that the most important pollutant from a public health standpoint from fire is particulate matter, and specifically PM 2.5. 70% of all the particulate matter emitted from fires is this fine particulate matter, or PM 2.5. I also wanted to just mention that, as was mentioned by your director, the 2018 National Prescribed Fire Use Survey identifies smoke management as the top impediment to implementing prescribed fire on the landscape. It was really only behind 2 other issues, and that would be weather, which we're going to hear more about later today, and personnel or capacity. So smoke management is a huge concern, even not during COVID times. So what is the big deal about these tiny particles known as PM 2.5? PM 2.5 is defined as particulate matter that is less than 2.5 microns in diameter. These are tiny, tiny particles. For an example, in comparison, the human hair is about 70 microns across. So these are much smaller than human hair, and they are not filtered out by our normal respiratory defense mechanisms, and thus end up being deposited deep into the recesses of our lungs. So once there, they can wreak havoc on our cardiovascular system. PM 2.5 is associated with aggravated asthma, increased respiratory and heart disease, increased hospitalizations, emergency room visits, and premature deaths. Because of this, because of the vast concern that fine particulate matter has on our human health, EPA has established a health-based air quality standard, a National Ambient Air Quality Standard, or NAAQS, for fine particulate matter. So let me just highlight something here. What else is going on right now that may affect our lungs and heart? Obviously, the global pandemic of COVID-19. So all fire managers know that they should avoid blowing smoke into a smoke-sensitive area or over sensitive populations such as schools, hospitals, nursing homes, highways, airports, and even the local or state air quality monitoring site that monitors for compliance with the EPA's health-based standard. Most of the forests that I work with keep maps of these areas and use them during the burn planning process to make sure that the prescription is written so that these sensitive areas are avoided. So I want to draw your attention to the bottom right of your screen. That is a statement from from CDC on their website. So as you can see, CDC has said that people who currently have or who are recovering from COVID-19 may be at increased risk of health effects from exposure to wildland fire smoke due to compromised heart or lung function related to their diagnosis with COVID-19. So therefore, fire managers now have two additional sensitive populations that they need to worry about: individuals currently with COVID-19 and individuals who have recovered from the virus. So I want to shift gears a little bit and tell you what the southern region of the Forest Service's perspective was during the beginning of the COVID-19 crisis and throughout the summer. So prescribed fire is heavily utilized in the southern US, you all know that, and approximately 1 million acres are treated annually just on Forest Service property in Region 8 of the Forest Service. Region 8 is shown on the map to your right. It's basically from Virginia to Texas and everywhere south. The target acreage that was set by the forests during 2020 was 1.45 million acres. That was the number of acres that we hope to burn during the 2020 season. However, as with everyone else, when the pandemic hit in March, the Forest Service suspended prescribed fire operations. But in mid-May, prescribed fire resumed in a very limited capacity, and I wanted to share some of what we did, and hopefully that will help you all as you are beginning your prescribed fire operations this fall and through the winter and spring. So when the southern region of the Forest Service decided to resume prescribed burning in the late spring, there were several procedures that were put in place. First and foremost, each fire required prior approval from the regional office. That was a new requirement. Each unit, no matter how small, required approval from the Atlanta fire shop staff and directors. Additionally, no variances were issued at all for any burns that were proposed outside of the regional weather parameters. So if the prescription was slightly out on transport wind speeds, on humidity, on anything, it would not be approved. Each unit was also required to fill out a COVID-19 worksheet that was developed by the regional office. That included detailed fuel condition information, detailed smoke production mitigation measures, and a detailed listing of nearby smoke-sensitive receptors. For each and every unit, regardless of the size of the unit, smoke dispersion modeling was required, and a COVID-19 situational assessment was required. This assessment looked at what the COVID-19 situation was for that time period in that nearby community. So I call this kind of the phase one of burning during the COVID-19 pandemic. So in addition to those parameters, guidance was sent to each unit listing additional elements that should be put in place to reduce the risk of smoke management issues during the burn, as well as reducing the potential risk to fire staff personnel from possible COVID-19 exposure with the resumption of prescribed fire. Operations were scaled, burn unit sizes were reduced so that minimum personnel were needed to meet the objectives. Only local resources were counted upon in the case of contingencies. Additionally, all firing needed to be completed by 4 p.m., and the firing tactics were adjusted and mop-up was increased in order to minimize smoke production. So as a result of the required COVID-19 situational awareness, situational assessment that I'll talk more about in just a minute, each unit was aware of the potential for new smoke-sensitive population and areas, and they also maintained communication with the regional office and with local officials throughout the burn period. Finally, because of the uncertainty that exists and that existed at the time and perhaps still exists with the COVID-19 situation, a nighttime smoke assessment was also conducted for each burn. This might have been a qualitative assessment using the superfog matrix of weather parameters that might indicate the potential for superfog formation, or we might do a quantitative analysis assuming that the superfog matrix indicated the potential for superfog. We would do a full analysis using the tool PBPMONT, which I will talk just a little bit about in a minute. So after a couple of months of burns needing to be approved by the regional office, and with no reported smoke management incidents as a result of that approval process, the regional office reverted approval to conduct prescribed fires back to the forest level. The local COVID-19 situational assessment, as well as smoke dispersion modeling, must still be completed by the local unit or in conjunction with the regional office resources if the local unit is unable to have that capacity. In addition, communication is still important with the regional office. So the bottom line is that from May throughout the summer, so late spring throughout the summer, over 40,000 acres were burned in Region 8 under the COVID-19 authorization process. The units that had the most burns included right here. Well, I'm not in Florida, but I'm there virtually. So right here in Florida, the National Forest in Florida led the way, as they often do in burning, as well as the Ouachita and Ozark National Forest in Arkansas and parts of Oklahoma, the Francis Marion and Sumter National Forests in South Carolina, as well as the Savannah River site in South Carolina. They did some burning as well. The National Forest in North Carolina, National Forest in Mississippi. The Kisatchie, who was first out of the gate to do some burning on a campground, because the campground was closed, they were able to get some burning done there that otherwise they wouldn't have been able to do. The Cherokee National Forest in Tennessee and the National Forest in Alabama. So I think that this was a pretty successful first and second steps in resuming prescribed fire operations during the COVID-19 pandemic. The region was able to get some hazardous fuel reduction burns in, some ecological benefit burns completed without negatively impacting public health. So I assume that starting this fall, if prescribed fire resumes, right now we are on a stand down due to the demands on staff from the Western wildfires, but I imagine we will continue to implement smaller burns with the same assessments, the COVID-19 situational assessment, as well as smoke modeling as we continue burning this fall and winter. So I've mentioned this COVID-19 situational assessment, and what I mean by that is a look or a snapshot of COVID-19 activity in the local community. One of the best sources of data for county level information actually comes from Johns Hopkins COVID Mapper. So I'll show that in just a minute, but I think it's the gold standard. It provides a lot of great information on what is happening in your local community. So last night or yesterday, I pulled the Leon County, Florida COVID-19 status report from the Johns Hopkins University. this is where, you guys know this, but this is where Tallahassee is. And this shows the number of confirmed cases so far in Leon County, the number of cases over the last 14 days. I don't know if you can see my mouse, but I'm pointing at this blue graph on the right-hand side that shows the oscillating, it looks like an oscillating pattern of COVID-19 cases. I suspect that might have to do with the university, the Florida State University being there. Down at the bottom, it has new cases since the previous day, the county fatality rate, and some other demographic information. So I think this is a really good tool to use to get a sense for what's going on in your local county. So every single county in the United States is available, a COVID-19 status report is available on the Johns Hopkins COVID Mapper. You can also look at the COVID-19 compiler. This is just an easy visual of where COVID-19 cases are increasing statistically over the last few days, maintaining or decreasing. So the red and pink areas are those areas that are increasing, and the rest are maintaining the same status or decreasing. Of course, you can always look at your state's COVID dashboard. This is the Florida COVID dashboard. And here you can see it has statewide information. Generally, you know, if we're talking about specific numbers, the state dashboard is more up to date than the Johns Hopkins dashboard. But as you can see, if I click on a county here, I'm going to click on, or I did click on the county just to the south of Leon County, so Wakulla, and we see that there is some good information, but it is not as comprehensive as that COVID-19 status report from Johns Hopkins. So if you are not from Florida, then you know each state's COVID dashboard shows different information, but just be aware that you know my opinion is that the Johns Hopkins county level data is really the best representation if you're looking for consistent data graphics and things throughout the country. So after determining your local COVID-19 situation in your community, we also need to look at what is going on in the air quality world. What is your local air quality, and what would be the smoke dispersion impacts from your burn? So local air quality condition data can be found in a lot of locations, but for me, the easiest place to get that data is the AirNow website, and particularly the AirNow fire and smoke map is a very good visual of where air quality is being measured throughout the country. That is the screenshot on the top of your screen, and it shows all the dots are air quality monitoring sites, and they are represented in the air quality index colors from green, meaning good. That means that measured values right now are good. Yellow is moderate, and then we get into orange, red, purple, and maroon, which is gradated stages of unhealthy to hazardous. I'll show that in just a minute on the actual website. Another really great tool is the brand new Air Spire Smoke COVID Dashboard. It pretty much takes all of the COVID data that I just showed on the previous screen, as well as the air quality information, and shows it together on one site and one page. The Air Fire folks out in the Pacific Northwest research station of the Forest Service have put this together, and it is password protected, but they've set up this password of this username of partners and the password as Smoke 2020 for us to get on there and to find county level information, and I'll show that in just a moment as well. Once you have your air quality information and your COVID situational assessment, then you need to see exactly what is going to happen with your burn unit. And so some of the tools that you can use that are available on the web are Vsmoke. You guys are probably all familiar with Vsmoke. Blue Sky Playground for a little bit more comprehensive and complex modeling output. and then PB Piedmont, which looks at the potential for nighttime smoke and superfog formation. So I'm going to pause sharing, and then I'm going to show you some of the tools that are available on the web to help you when you're doing your own assessments back in your home unit. So I'm going to pause. All right, and I assume that you can see my screen.
Yep, looks good.
Great, so I have several tabs up here at the top, and I'm going to show you those one by one. I'm going to first click on this Johns Hopkins Coronavirus Resource Center. Here is where you can see globally what's happening with coronavirus cases and deaths and recoveries. Then you can click on the US map. And it takes it just a minute to fill in all the county data. You'll see it's in shades of pink or purple, depending on what you call it, as soon as it fills in. It's being a little slow. So you can see that this is county level data for each county within the United States. And then we can either scroll or we can use the state and county search data to find our own county of interest. So just for time, I'm going to hit Alabama, and the first county on the list, I think this is organized by COVID prevalence. So Jefferson County has the highest COVID prevalence in Alabama, and it scrolls to that area. And once I clicked on it, so once I click on that county, which is where Birmingham is, I get some information that, yes, indeed, I clicked on Jefferson County, Alabama, and then I have the COVID-19 status report. And when I click on that, here we get the status report similar to the one that I showed for Leon County, Florida, for Jefferson County, Alabama. So you can do this for whatever county is your local community that you're burning in, or that you're concerned that smoke might blow over, to get what the actual COVID-19 situation is for your location. All right, the next thing I'm going to show is the AirNow website. There are two AirNow websites that I want to highlight. The first is the air quality forecast. So this is the forecast for today in the air quality index colors. I'll turn on the legend so you can see what the air quality index means in these colors. And so it doesn't show green because it's assumed that every area that's not yellow or worse will be green. So there is a little bit of yellow in Florida, but as we go further west, because of the wildfires, we have much worse air quality forecast for today, particularly over California and then southern Wyoming and northern Colorado. The next website I want to show is the fire.airnow.gov. So I showed this, a screenshot of this earlier. It's a lot of the same information that we saw previously on the AirNow site, but this has the actual monitor locations and what the current AQI, or air quality index, value is at that monitoring location. So again, lots of poor air quality in the west, good air quality in the east. One thing that is interesting about this, just so you can see it, I'm going to turn off the monitors so you can see the fires, both large incidents that are identified as well as satellite detect fires. And then very interesting, the satellite smoke plume detection. So you can see, even if, even here in the east, even if we are not necessarily smelling smoke or even seeing smoke, somewhere in the column above our heads would be some smoke from the western wildfires. So the next link that I'm going to show is the Smoke and COVID Dashboard. This is the most, probably the most exciting one that that I have to share with you because it's brand new. So you may not have seen this before. The first time you visit covid19.airfire.org, you'll be prompted to enter a username and password. And as I said earlier, that username is partners with no capitalization. Password is Smoke 2020 capitalization. So the first time that you visit it, you will get this overview of the United States. It takes just a minute for it to draw. And you can then hone in on your particular area. So I'm going to go back to Florida, and I can pick Leon County again, click go, and this will provide a lot of the information that I showed you earlier, but it's compiled on one page. So the information at the top is just an overview of the COVID-19 situation. So that would be the infection rate, the number of cases that are coming back positive from all the tests that are performed, the new case graph, or how are we progressing? Is it going down or is it going up? The doubling period for new cases. There is also some fire detect information. Are there any fires that are nearby? And then the air quality information. So this is measuring, polling the local air quality monitor to say if it's good, moderate, what's going on at the local level. And this is saying that the local level, the current PM 2.5 levels are good. The recent trends pretty much are steady, low exposure, and it's ranked at one of the cleanest areas right now as far as counties in the country. So if we scroll down a little bit, we have county information. This is some demographics, specifically for COVID, but also for smoke-sensitive targets in general. But as we know, and as we've learned over the last several months, COVID does tend to hit certain socioeconomic and people with certain pre-existing conditions more difficult, in a more severe way than others. So this has that information on a county level. So in Leon County, what the population is, what percent of the population is living in poverty, statewide obesity and diabetes information, social vulnerability index. So you can click on that to find out more what that might mean, and then hospitalization availability of beds, et cetera. So that's, I think that's really good information. And this graph on the right shows, are we close to a monitor? What percent of the population do we know is close to an air quality monitor? But let me go back to the left. I'm going to click on the COVID situation. This shows what the infection rate is for the county. So it's 3.6% of the tests are coming back positive within the county level. And then over here on the right, it has our total cases year to date, our new cases, 7-day average of cases, and the 30-day average, and how that ranks not only within the United States, but also within Florida. So year to date, Leon County ranks 15th in the number of cases throughout Florida. And then the same information for deaths. I told you that it looked at fire detect information. It's a fire rose. And if you scroll down, you see where the fire detects are. Well, it did earlier. It's not, it's not showing up, but generally there were some fire detects up here in Georgia and Alabama, but not really near Leon County. So it's a little sensitive when you use your scroll, the scroll bar on the mouse. Okay, PM 2.5 observations for the last 24 hours within that county. So it's been green or good. And the forecast, and this, it comes from the Air Now website, and it is forecast green right now, possibly could get into slight yellow, as I showed on the AirNow website earlier on that forecast screen. All right, so that is the Cova Dashboard. And then we can look at Vsmoke. If you haven't seen this before, this is a very, very simple tool to use to assess your predicted downwind impacts from your burn unit. You fill out some information over here, just on your latitude, longitude, acreage size, and just a very, very brief information. Click Run Model, and then you get this output of the predicted worst case hourly plume in the air quality index colors. Just for the sake of time, because I want to be able to answer any questions that you may have, I'll also show you PB Piedmont, which is also developed by the Southern Research Station folks in Athens. And you can see it's got a similar feel as the Vsmoke tool, but it asks for even less information because all that it is doing is assessing the potential probability of smoke and superfog forming during the nighttime hours. So I did the same location on the Apalachicola National Forest, and I did a start time and duration, and I ran this earlier to make sure that I could show you the results. And let's see if the results are ready. It says it is, so let me view the output. And so it's just going to animate this for just a minute. You can see the radio button going from hour to hour after the start of the burn. Okay. So this is showing the probability of downwind smoke, which is in yellow, and fog, which is in red. Now this is probably not going to show any superfog formation because of either the forecast or because we're in, depending on the topography, but it generally does follow the drains. Depending on where you're at on the landscape, you might see some superfog formation that would be likely. So this is a good tool that you can use for if the superfog matrix indicates that superfog may be likely. All right, and then finally I want to show you Blue Sky Playground. So if you go to airfire.org and click on tools, you'll get to this screen, and you can see that we can look at Blue Sky Playground, either version 3 or version 2. If I click on version 3 and I fill out some information, I don't want to mess this up. I don't want to mess up my current run, so I'm going to just click on what I did earlier. And again, I did the same location on the Apalachicola National Forest. I went through they call these subway stops up here at the top, the emissions inputs, emission results, meteorological inputs, dispersion inputs, and then I clicked on dispersion. It uses high split to run dispersion, and we get a result. And I will scroll in just a little bit so we can see what that is going to be. These are not displayed in any sort of air quality index colors. It is in shades of gray, from 1 microgram per cubic meter, which is very, very almost non-detect as far as public health impacts, all the way up to this black, which would be over 500. So let's see what it looks like. So you can see that the plume is heading to the south into the Gulf and dissipates throughout the day. This was a 400-acre burn unit. All right, so I'm going to pause sharing and bring back up the tools that I just showed, the websites, so that you can note those if you want, and then I'll be happy to answer any questions that you may have.
All right, Melanie, thank you so much for your presentation. Folks, this is the time to put your questions into the Q&A tool in Zoom. So we will use that to try and get to the questions that we have time available. We have about 2 to 3 minutes left, so we'll try and squeeze in what we can get through. Melanie, thanks for all those resources to share, and appreciate all the help from Laurel and Mary Nell, who were making sure to get the links typed into the chat window. I hope you guys were able to get those links. One of the questions that came up, Melanie, was from Greg. And Greg asked if when the U.S. Forest Service region returned burning back to the local units for approval, Greg asked, did this allow variances again?
No. I didn't specify that, but no, it did not. Now that may change this fall and winter if we start prescribed burning again, but it did not. It was basically the same process, but it was just approval at the local level.
You got some kudos on here for folks who appreciate you sharing all these great resources. We had a question that came in, and the question is there any data on firefighters who have recovered from COVID?
I do not have that information. I know that there have been several firefighters that have contracted it, but I have not seen that information. I'll be happy to look for it though. And I think that Pete Lom in our Washington office has a lot of that, is keeping a close eye on that information.
Great, thank you. Can you also share the request came in for that password and login for that Smoke Cova Dashboard? It's a pretty interesting tool. First time I've certainly seen that.
Yeah, it's new. So yeah, if you want to type that into the chat bar, it's partners and Smoke 2020.
And the last question I see came in, and we may direct this one to John Sadler, but the question is, with the Florida recent change to stage 3 of open for business, is the Florida Forest Service able to do on-site landowner assistance? So I think that's probably a question from John or somebody else from the Florida Forest Service, and we'll try and see if we can get that information to you. All right, Melanie, thank you so much for your presentation. It looks like we are up to the top of our time here.